So today I wanted to do a video about my experience with psychiatry as someone that has a AvPD, and that'll include some of the therapy I've tried and some of the prescription medications I've tried. And disclaimer, I was not diagnosed or even aware of AvPD during most of these events. However, that doesn't really, in my opinion, change how any of this would have went or will go when I attempt it in the future, because the current treatment prospects for AvPD are more or less about treating specific problems. So social anxiety, treat it like social anxiety disorder. Depression, treat it like depression and anything else, right? So the first thing I tried is I did cognitive behavioral therapy with a psychologist for half a year, approximately, starting in June 2017. And CBT is probably the most recommended therapy for a whole lot of people, but especially for anxiety, depression, and AvPD, which again, I wasn't officially diagnosed with anything at this point. So my brother always drove me to these appointments because, like I've talked about before, I definitely have pretty bad anxiety with driving, and when I already had to go to these appointments and deal with talking to someone I didn't want to talk to and didn't necessarily have faith would be able to help me, I was very anxious already, so he always drove me to and from these appointments. So got there, met the guy, and over the span of these months, I didn't ever especially relate to the guy, but I didn't dislike him. He was nice enough. So I stuck with it for a while. One of the problems I had with him is that, to some degree he thought he could relate to my social anxiety because, most people do, because they've dealt with some social anxiety, so they think it's kind of the same thing but worse. And it's true, but you can't really understand what exactly that is unless you've experienced it. And as someone that has a job talking to people all the time, you probably don't have quite as much social anxiety as I do. But to be fair, he didn't say that he did, and he kind of tried to redirect the treatment towards depression, because now I would say with AvPD, I'm pretty aware of the fact that most of my depression, it comes from my anxiety or things that I can't do because of my anxiety. And at the time, I wasn't sure it wasn't the other way around. Depression is causing me to be super anxious. And it was fair that he took that approach as well, because I had talked to him about how suicidal I was feeling all the time. So, it makes sense that he would take it from that angle. So a bit about CBT. It's basically supposed to fight your issues using logic. It focuses on the tenet that your thoughts, feelings, and behaviors all affect each other, which seems reasonably true. So the goal is to determine which ways those things, your thoughts, feelings, and behaviors, might be irrational and try to correct them, working on all three at the same time so that you can make progress on all of them and not let any backslide on the others, right? So basically, for me, it'd be stuff like the therapist trying to politely get across to me the idea that, I shouldn't assume people are judging me. If someone thought, if you thought someone was judging you in this particular scenario, what's an alternative explanation? That sort of thing. Why you shouldn't think that you're worthless, why you shouldn't take criticism personally, all that sort of stuff. So I think that this approach can work for some people that aren't necessarily particularly self-aware, and they feel really bad about themselves and what others think about them, but they don't necessarily actually realize that these things aren't necessarily true. I think the reason it may not be an effective treatment for AvPD, or at least for me, is that I'm already very introspective, and I think a lot of people with AvPD are, because we're extremely self-aware, paranoid about what we're doing and stuff. And maybe when we're young, that doesn't extend to realizing that it doesn't make sense. But I think as you get older and deal with it longer, you're paranoid about all these things about yourself, and yet you're still realizing that doesn't make sense. I don't need to be worried about that, but I am anyway. So he didn't say this explicitly, but my opinion is that this guy thought that if I knew my anxiety to be illogically sourced, that I could ignore it. And since I wasn't able to ignore it, in spite of me telling him that I did understand that it was illogical, he didn't think that I understood. So he took the angle of trying to make me understand why certain sources of anxiety are illogical, like why you can't assume that person's judging you just because they're looking at you, glancing at you for a second or whatever. But the thing is, I do understand that those things are illogical, and I can't ignore it anyway. And I tried to explain to him why I can't ignore it anyway. I didn't have maybe quite as good a grasp to explain it then as I do now. But to explain it right now, for anyone that doesn't understand why you can't ignore an illogical source of anxiety, well, there's two reasons. First off, there's the physical symptoms. These should be pretty obvious. If I'm in a panicky anxiety situation and I'm shaking and sweating and stuttering and my teeth are chattering visibly, people can see my face shaking, I'm blushing, I have a headache, I have a stomach ache, those are things that I obviously can't ignore. Of course, the theory then as well, if you can ignore the mental aspect that causes the physical symptoms, then you won't have those, right? So explaining why I can't ignore the mental side of it is a little more complicated, so I'll try to use an analogy. So imagine a pop-up on your computer that warns you a certain program is a virus, and you know the program isn't a virus, it's safe to use, so you close the pop-up. However, let's imagine there's a bug in your operating system or whatever on your computer, and the pop-up just keeps coming back, and eventually it just covers the entire screen in pop-ups. So sure, you can choose to close each pop-up clicking on the X button on each one of them. However, once these pop-ups are covering the entire screen, you can't ignore all of them and just use your computer as normal, because it's in the way. It's stopping you from using the computer as normal. So this is how I see my brain about illogical sources of anxiety. There's an air that makes me terrified of everything, and even though I know and keep reminding my brain that there's no good reason I should be super anxious about these things, because they aren't real sources of anxiety, or at least they probably aren't or probably shouldn't be, depending on the exact scenario, my brain keeps sending me those pop-ups basically, and flooding my brain with it, and it's literally impossible to ignore it. So I made an attempt to explain this to the psychologist. Like I said, maybe I didn't have quite as good an analogy. Maybe that analogy isn't good, but anyone who's dealt with this, I think, can understand, even if other people really can't quite grasp it. And basically, at the end of the day, we couldn't ever get past that, because to him, that was what had to happen. Is I had to understand that these things were logical, which I did, but then I also had to be able to take that and use it to ignore the sources of anxiety. And if I know that a person's probably not judging me, then I should be able to ignore it and not be anxious about it. If I know a person meant a criticism just to improve my work and it wasn't supposed to be personal, I'm not supposed to take it personally, right? And I know all of these things already, but I can't do it. So basically, we couldn't get past that, and so we mutually agreed that we should stop treatment. His end goal with me, more or less, of course, treatment in therapy is supposed to last a long time, if not indefinitely, for someone with a personality disorder, which we didn't know I had, but even with severe anxiety. And so his end goal, more or less, was to get me to start doing exposure therapy type stuff, which could include group therapy. One particular thing he was always suggesting was trying phone calls, because as someone who wasn't particularly socially anxious, he didn't grasp that phone calls can be more difficult, if not at least as difficult, as face-to-face interactions, for reasons I've explained in another video. In any case, we'll talk a little bit more about exposure therapy sorts of things at the end of this video, because it's important, but I'm gonna get along with the psychiatry experiences right now. So after I quit seeing that guy, the next psychologist I saw was in 2021. I saw a psychiatrist shortly after my 2017 psychologist, and we'll talk about that in a minute, just to keep the medicine separate from the therapy. So I saw this other psychologist in 2021, and this is the guy I talked about in my diagnosis video. I mostly went to this guy for the purpose of getting a psych test for an AvPD diagnosis. I thought I had AvPD. I found a guy specifically with the goal that I thought would be able to diagnose me with that if it is what I had. So I'm not going to talk about the test again, obviously. I just want to talk a little bit more about the surrounding situation with the guy. So when I went in, I was still considering starting therapy again with this guy if I liked him. Unfortunately, I didn't. He had a similar sort of confidence that he understands your problems better than you do that the other guy had, but the other guy, I felt like, he wasn't trying to project that on me. He wasn't trying to show that he was smart. He really thought he had a really good understanding of pretty much anybody's brain, which I think is hard to do, even if you're a real expert that spent a lot of time studying. Everybody's different. So even if you're an expert on a personality disorder, which this guy was not, then you're not going to be an expert on every single person's experiences that come to you, and you have to be ready to learn and work with them specifically. This guy was a little more projecting of his intelligence. He was very clear about the fact that he was pretty sure he got my whole deal, and we can fix it. Don't know exactly how long it's going to take, but here's the plan. Like a textbook sort of issue. And so I didn't think I'd necessarily benefit from having him as a therapist even before the test. And I also did not necessarily mesh with his personality. Like I said, maybe a little bit pretentious, a little bit arrogant, but also he reminded me of myself quite a bit. He was very sarcastic and thought he was being funny and stuff a lot of the time. And, there's nothing wrong with that. I'm a very sarcastic person, and I probably always will be. But I do not think I would make a good therapist, even if I didn't have these problems, partially because of that sarcasm. I don't think that's a good attitude to have for treating someone. To his credit, he might have thought he was relating to me. Now, he didn't know that I was a sarcastic person. I didn't really act sarcastically towards him. Maybe I was a little blunt because, I didn't have much confidence that he was going to help me, so maybe I was a little, dismissive or something, and he took that as maybe sarcasm will mesh here. I don't know. It seemed like his personality, and in any case, it didn't seem like the sort of approach that would necessarily be comfortable for people to come in and talk to you and reveal a lot of uncomfortable details about themselves, basically. So then I took the test, and 6 weeks or so later, I got the results, and that is the only time I saw him again, which is when he was giving me those results, and we discussed them briefly. And I want to talk about something here that's it's a little embarrassing. It's going to sound kind of like humble bragging. It's not, but it does kind of feel that way. So I just wanted to point that out, that I'm not trying to be egotistical here or anything, but he made me quite uncomfortable because what he focused on most when we were discussing the results of the test was the results of my IQ test. He didn't really pay much mind to the fact that I had just been diagnosed with a personality disorder that cripples my entire life. He put more focus on my intelligence, which he praised, and my potential, as he said, as a good reason to pursue treatment, because you need to unlock that intelligent potential. Wow, look at how smart you are. And I'm not just saying that as reading into it, because obviously people with AvPD do that. He was explicitly talking about the results of an IQ test, which is really silly, because if you've ever taken an IQ test, you probably realize they don't have that much relation to your intelligence. They have more relation to how many vocabulary words you might have memorized, or how much you might have remembered from high school. And it's just a consequence of my interests that I happen to be good at taking IQ tests. I know a lot more vocabulary than the average person because I like to write, and I especially like to write stuff for like RPG games, which means I know some nerd words. So for example, the 50th word I had to spell on my IQ test was pusillanimous, which is a word most people have probably never heard, that more or less means cowardly. And I only knew that word because I wanted a synonym for the word cowardly that started with the letter P, so I could do some alliteration in something I was making. Right? So that doesn't make me smarter than anybody else, but I spelled the last really weird word right, so I must be super smart, right? It doesn't mean that. And similar sorts of things with math. I'm familiar with certain types of math more than other people that are a few years out of high school might be, just because I like programming. And so I do math regularly, even if not in my head. So, besides the fact that I feel like it has no relation to my intelligence, I was not comfortable with the fact that this guy was focusing on my intelligence here. It was, I guess, supposed to be nice and complimentary, but it really felt more like brain in a vat type treatment. You got to get treated so you can go be productive for the world. And it felt especially bad because I expected that when I showed a particular family member the results of my test, they would do the same thing. And it turned out later when I did that I was correct. They did the same thing. They more or less ignored, well, I'm sorry about that, but, and went on to just talk about how smart I am and you're almost a genius. So yeah, anyway, that made me really uncomfortable, and what I wanted was understanding about how to help with my anxiety and not compliments to my perceived intelligence based off of one random IQ test. Anyway, so that was the end of that. With that, I was definitely pretty sure this guy was not going to be a therapist for me. So from that point, I have not spoken to another therapist. I'm sure I will again at some point in the future attempt something. Maybe group therapy next, who knows. But that's all the therapy I've tried so far. So the next thing I want to talk about is prescription medication. So I've tried, I believe, 5 prescriptions, starting a few months before trying therapy and proceeding a few months after with a psychiatrist. At that point, I started with a general doctor that my family knew. I didn't even go to a regular doctor at that point, nor now. I haven't since middle school, probably. In any case, I can only find bottles for 3 of these prescriptions, and obviously I'm not the sort of person that's going to call my doctors for medical records, if I can even remember who they are at this point. So I'm only going to talk about the 3 that I can find proof that I've taken and that I remember, because I'm pretty sure I took 2 more, but I don't know what they are. So we'll go with these 3. So I know that I took Zoloft, Prozac, and Prestige, and I took each for approximately 2 months, meaning daily for 2 months, or whatever the dosage was. I believe it was once in the morning, more or less. So all of these medicines except one had no effect whatsoever during that entire period. Nothing negative, nothing positive. It was like I was not taking them. I was taking them, I am certain. Then the last one medicine had no positive effects and had one minor negative side effect, and I don't really want to talk about that in this video. But yeah, that's all any of these medicines ever did. One minor side effect from one of them, nothing positive, and I did take them for 2 months, which is, and that's an approximation. I took most of them a little longer, I think, but the point is that should be more than long enough for these medicines to start working if they are going to work. So some of these medicines were geared more towards anxiety. Some of them were generally to treat the depression first, because again, that was the doctor's approach in general. I think because these medicines are probably better at treating depression rather than treating anxiety. So they hope that the anxiety will improve when the depression does. As far as prescription medicines, I do think they're worth trying, and at least one person that has commented on these videos with avoidant personality disorder has shared that they have had success with Paxil, which is an SSRI for anxiety and depression. And that's not one that I've tried, I'm sure of, and I may try it in the future if I do try another of this class. However, I suspect that the more ingrained your anxious mannerisms are, the less effective you might notice these medicines to be. And that kind of sounds believable, but I haven't necessarily come up with a good explanation as to why until now. So the reason I think that might be is because I think there are varying severities even beyond whether you just have social anxiety disorder or AvPD. So I think your AvPD can have a varying effect on your personality. It is a personality disorder in any case, but it can be more severely tied to your personality, or it can be less severely tied, right? It's just degrees of the same thing. So a reduction of my anxiety is not going to make all of these personality traits go away, and then the anxiety is going to come back. That's more or less how I view it with these long-lasting but more chill medicines that are supposed to get you to a good place and keep you there without really changing you. So some of the personality traits that I think are super exaggerated for me and are the reasons why my anxiety can't just go away with a medicine like this is I am fixated on paranoid observations of others' behaviors towards me, and even other behaviors towards other people. I pay attention to this stuff constantly. Even if I'm not super anxious, I'm always just looking at what other people are doing, even if I'm in a more comfortable scenario. So that's reason to think that these medicines that don't change that behavior and are just supposed to reduce my anxiety might not fix this, and therefore will end up bolstering my anxiety again. And I'm not going to go over that explanation again with all of these points because I think you get the idea. But I'm also extremely concerned with my own position relative to other people and my body language and what I say and how I speak. I have very low self-esteem and feel bad about criticisms even if they're minor or if they're unwarranted. I dwell on things that will happen and how they will go, or that have happened and how they did go. I'm very cynical and assume the worst about things that will happen or what people might have thought of me and something that already happened. I'm also very sarcastic, absurd, and easily irritated. So basically, I've just got this super negative, anxious personality that makes other people uncomfortable. And I don't think a very small tweak to my anxiety to bring me back to a normal equilibrium would necessarily work. And that is my opinion on the non-brain chemistry specific reason of why these longer term medicines may not help me. Again, I haven't tried the whole list. There are a whole lot of them. So it may be the case that another one would be more helpful. But I am wondering if paradoxically short-term medicines might be more useful for a long-term or permanent, in this case, disorder like a personality disorder. Because long-term meds are trying to get you and keep you at this comfortable state, whereas people with very severe personality disorders might not ever be able to get to that state with those medicines because they're sort of, they're just supposed to bring you to an equilibrium, and we're a little too far away from that equilibrium, in my opinion. Some people with a personality disorder could be, is all I mean to say there. So I'm wondering if something more intended to alleviate temporary symptoms to a higher degree might be more successful. However, of course, these things tend to have more side effects. So I haven't tried any of this yet, but I have considered something designed specifically to treat panic, more or less, or just intense momentary anxiety, such as Xanax or another benzo or sedative. The main reasons I haven't tried yet are, one, they can be addictive and you have to limit your use of them. And as someone who's super anxious, if that actually works, you could definitely have a hard time limiting your use of them and just hoping you won't get addicted to them and have problems from that, and you certainly could. So that's one reason I have not decided to try them yet, but am considering it. Another reason is I just don't want to deal with doctor anxiety. Every time I have to go to a doctor, it's just more anxiety. It doesn't matter who it is. If it's a completely new person or a person I already like, it's just more anxiety because of the base social anxiety, basically. To add to that, the psychiatrist I did see for these medicines, he was definitely not a good fit, and I would definitely have to find a new one because he had a habit of making me wait about an hour in his waiting room, even though I arrived on time for my appointment. And he had the usual sort of American medical scheme where if you want to continue your prescription, you're expected to come in for regular appointments, even before there could possibly be any effect of the medication, just weekly check-in. And not only does this cost a lot of money that guy would like to earn from me, but also it makes me super anxious when I have to constantly deal with that, and it makes me not want to keep up trying with these medicines and keep going to the doctor, sit in his waiting room for an hour and then talk 5 minutes. Is it working yet? Nope. Okay, keep trying. Or if it's past the time which is supposed to work, then we say, okay, let's start a new one, and he makes $140 or whatever off of that. And you just kind of go down the whole list of medicines. So it's certainly difficult to find a doctor with which I am comfortable, with which I don't have to deal with those sorts of things. And I probably will try again at some point with either therapy and or medicines, but we're not there yet. I'm not in a good spot to deal with it. That's why all this stuff's so spread out. You just have to really feel like you really have to try it, and if you don't, then you can't really make yourself do it sometimes, which is the case with anything with this disorder, but it certainly applies to trying to get treatment. And so briefly at the end here, I just wanted to wrap up talking about exposure therapy, since of course that's what both of these psychologists I went to have wanted me to try, and I do think there's good reason for that. So if you are not familiar with the concept, exposure therapy basically just means forcing yourself to confront your anxiety so that you can come to a natural understanding that your sources of anxiety are not valid reasons to be anxious, and just force your brain over time to stop alerting you as much about sources of anxiety, because your brain knows you're going to ignore it, so it stops bothering you. That's the idea. But of course, it's extremely difficult to force yourself to do this in the first place, like I already talked about, even just going to the doctor's appointment. But there's other problems with it as well, which are that negative or even neutral situations that you get yourself into when trying exposure therapy can reinforce your anxiety rather than lessen it. So you would think it'd have to be something terrible to prove that you have to be more anxious, but with this disorder, if it's really bad already, which it is for me, you can have something go perfectly neutral where it wasn't particularly beneficial, but there was literally nothing bad that happened. But it still is going to bother you and make you feel worse because, for one, it just didn't go well, and you needed it to go well. You need to show that it's a good thing for you to go through this anxiety, right? Um, and then there's also the fact that you're overanalyzing it later. It might have felt like it went fine in the moment, and then you keep thinking about it and you dig up reasons that it actually didn't go fine, or reasons that it could have not gone fine if things went slightly differently. Now, I still think this is more or less the end goal for people with AvPD at this point. You're probably not going to see much improvement unless you're able to do this. But it's really important to basically take it at your own pace, because not everyone, even within this disorder, in my opinion, has the same level of difficulty with it, because nobody has exactly the same experience. And it's going to be hard for everybody with it, but it's going to be closer to impossible for other people, and you have to take it at your own pace and do things that are just a little uncomfortable for you and gradually expand what that is. So if you are lucky enough to be able to avoid it, don't jump into the deep end. For example, obviously some people with this disorder are forced to work and stuff like that. I fortunately am in a situation where other people are helping me out and I don't have to do that, and I know not everybody's that lucky. But if you are able to, you should not try to feel bad or feel guilty and force yourself into doing something like getting a full-on interaction job immediately, because it will probably make things worse for you, or at least not help. And if it doesn't help, it might make you less eager to try again in the future. It also includes things like relationships or going to hang out at a bar with an old high school friend or something. Just don't feel pressured into anything because someone wants you to do it, or because other people with AvPD said they have made that sort of progress in that way, because you can't compare yourself to anybody else. It just doesn't make sense. You need to deal with your own issues. I feel like I'm sort of on the deeper end of people with AvPD, but at the same time, I'm lucky because I have had friends in my life. I have had something at least resembling a job in high school. So, you know, I'm not starting at nothing. There are worse scenarios than me for sure, and I'm fortunate for that, and I try to make progress right now. I don't see what the next step is, but, you know, we keep looking. So the key here is really try not to compare yourself to other people unless it makes you feel better to do that. And with AvPD people, it usually doesn't. Try not to, you know, people's progress might inspire some people. For me, seeing other people's progress makes me just feel like I'm a fuck up for not being able to do the same thing. But it isn't true. I've had different experiences and I have to deal with it in my own way. And, you know, the truth is right now, probably the only real help for AvPD people is going out there and doing it. But what it is and when it is depends on you specifically and isn't the same for everybody. And I don't, like I said, I don't know what my next step is right now. So I can't necessarily offer a flowchart plan for you to go find out what might be the next thing for you to do. But you know, you'll know it when you see it, most likely. Something that you really want to do, something that you are pretty sure will go well, but not too sure at the same time, because then if it doesn't, that's not good. Anyway, it's a hard thing. I'm going to stop babbling now. So I just wanted to share a bit more about my experiences with therapy and medicine, and I probably will try both again in the future, but this is what I've dealt with so far, and you know, that's sort of the deal with AvPD treatment as far as I see it right now is if you think you're not very self-aware, you should talk to a therapist. They will help you become more self-aware and realize that you don't deserve to blame yourself for all this stuff. However, I feel like I and probably a lot of AvPD people already realize that. And medications are worth trying, and they might help you. They have helped some people that have commented in my comment section that have AvPD. They have not helped me yet. And I might try something anti-panic oriented next. But again, those have their own risks associated with them, and same pain in the ass of going to a doctor. So we'll see what happens next, and whenever I am able to try something, whether it's more therapy or more meds or just exposing myself to social situations more, then I will certainly update about that. And I will have at least one more video coming up soon. I got one more thing at least that I want to talk about, And other than that, if you guys have any specific things you want me to talk about, you can let me know, and I'll try my best to do that. But yeah, that's all for this time, so thanks for watching.